Hi, good morning. We're sitting here with Dr. Kate Wilson. Hi. So we finished our training last week. And why don't you tell us a little bit how you found out about the AtlasProfilax method, and then we'll ask about the training a little bit.
Okay, great. Good morning. So actually I was fortunate enough to have the treatment about 9 years ago in South America, and had heard about it from a massage therapist that I had been seeing for chronic pain I was dealing with. I was already a licensed physical therapist, but at the time I was primarily a mom, stay at home. And so the treatment was highly effective. I found it to be highly effective, but at the moment it wasn't a possibility for me to get trained.
So what improvements did you notice for yourself?
Well, so for me, before having had the treatment, I was really bad off. My head was heavy to hold out. My arms would go numb every day. And so immediately after the treatment, both of those things went away. And then I had chronic pain, kind of mid-back and neck, that eased up, and then eventually I was able to completely rehabilitate through additional exercise and stretching. Complementary modalities, exactly. But those wouldn't work at all prior to the treatment.
So you could say that other modalities are less necessary and more effective after this treatment.
Yeah, in my case, they were really needed just because of multiple whiplash injuries and structural issues, right? That were, over time had become chronic. So I needed the Profilax jumpstart for sure, and I needed to do some strengthening and some other things, just rehabilitation, basically learn to move again, I guess, right?
And so that was about 9 years ago.
Yes.
And then last week we had a training here. So in a few things, like what was the experience of the training? How was it? And maybe what some new insights you had, and how did it land with some of the patients that we treated?
Yeah, so for me it was fantastic to get a little bit more information and a greater understanding of the anatomy and how, in fact, the treatment works so effectively and efficiently. I'm kind of a nerdy scientist, and so it's very interesting to have that, and really fun to be with you and to have the great conversations and sidebars that we did that were very anatomical and medically based, but yeah, it was very nice to get that greater understanding, and then ultimately be able to do the technique and help more people.
Right, so having this single overlooked mechanical cause of pain that can be addressed and solved simply and safely.
Right, and for me it's not, I haven't overlooked it just because of my focus and specialty is really cranial osteopathy.
Right.
So I'm dealing with this part of the anatomy an awful lot, and have realized, I wrote an article a number of years ago, it's all in your head. Not that you're crazy, but your head's not on straight.
Okay, interesting.
So that part for me was already like a given. I completely get that.
Right, so it provided just more clarity.
It was just nice to get, I didn't know about the myodural bridge, if I'm allowed to say that.
Of course, yeah, it doesn't matter.
But so that was really fascinating to get into that, and with the understanding that I already have, which I think most of the people who are looking to take this training have a really significant understanding already anyway.
And so in terms of your patients, we saw some of your patients last week.
Yeah.
And you want to talk about any of the results? What changes?
Yeah, great results on the people that we had come in with headaches being alleviated, and neck tension and neck pain and back pain, and sleeping improving, shoulders getting freer. I think that's kind of a nutshell of what we had last week, and I look forward to. I mean, my clientele is essentially the people who tried everything already, and they have a lot of complexities because of the chronicity of their dysfunctions, right? And because the whole spine gets involved. So I feel like this is going to be a great jump start for those people, and will be a really fantastic, more efficient way to help people.
Well, great. Thank you. Welcome to our team here. I'm so happy to have you on board. I think you're going to make a real big difference in your community here, with a lot of the chronic pain patients, and I look forward to collaborating, and thank you.
Thank you.
All right, thank you. Cool. Thanks.